Hi, I'm Shante Spriggs. I am 51 years old. Yes, 51. And I actually grew up right here in DC. I wear so many hats. So, my day job is I work for a financial institution, a global financial institution. But outside of that, I call that like my handwork. But my heart work is I'm a community impact specialist or consultant for several nonprofit organizations, but specifically I help empower other women living with HIV to ensure them that they can still be productive and powerful even with purpose. So I'm a person that always look at what the first was. Whatever the first of anything is always important to me. And so my first provider is someone that will always be near and dear to me. Because of the stigma that was associated and is still associated with individuals living with HIV, I opted to travel to Charlotte, North Carolina for care. Here it is, I was traveling almost 2 hours in traffic, 3 hours, a little bit past Charlotte just to seek care. And I remember the first time I went into the office, I sat outside and I looked at the building and I said, why does it say infectious disease on the outside? Right beside it was this beautiful hospital. I can see the flowers. It looks like they were just building it. But over here, it was this dull colored building that said Infectious Disease Center. I went in and the receptionist greeted me as soon as I came in. She asked me immediately, how was your drive? And in that moment, I was able to just pause and relax. And she handed me, of course, my normal intake papers. And for the very first time, I remember when we came to the question, I had to check the box that says HIV/AIDS. So I went in the back and I met my provider, and he had been treating individuals living with HIV for years. And he told me I was in good hands. But of course, I wasn't sure. And so as time went on, there was a particular era where I was traveling a lot for work. I was in school. My kids were in high school. I was going from being a married woman to now a single mom again. And there were so many different things that was going on. And I was completely just not myself. And my numbers had started going down. My CD4 count had started dropping. At that point, I remember coming to a visit and he asked me, he said, "Are you stressed out?" And I just began to cry because there was so much weight on me and I was so heavy. And he said, "Let me tell you something." And I remember him sitting on like the counter there. He said, "I'm not worried about you and HIV or even you and AIDS." He said, "If you don't get in front of this, it's going to be the stress that kills you." In that moment, I realized stress was a big piece and a key factor in my overall wellness. And I started looking at what was around me. And slowly, it took me a while, but slowly but surely, I started removing the stress factors and removing the toxicity. And still to this day, I pay attention to that. Going back to that first doctor, whenever things are a little off in my body, I go back to, okay, is this stress showing up? And if I don't get in front of this, it's not going to be everything else that takes me out. It's going to be the stress. And so I'm forever grateful for that provider helping me not just to see my HIV, but helping me to see I don't have to carry the load all the time. So there's just some things that are just non-negotiables for me when it comes to seeking care. So for instance, I need my provider to see me. I need my provider to not only just see Shante, but see the black woman that's aging with HIV. At 51, there's a lot going on with me. And so we may need to do some adjustments or modifications as a result. I also need my provider to do research. I should not be the only one coming in talking about the latest medication or the latest nuance. It needs to be a partnership. It needs to be a relationship. Also, if I can tell that you're trying to rush me out of your office and you're trying to hurry up and get to your next patient or meet your time slot, and you don't notice the look on my face or you don't notice I have dried up tears, then no, you're not the provider for me. Because although I may have came in for one thing, there may be several things, several layers that's underneath there. And so it has to be a partnership. It has to be a relationship. And I'm so grateful that's what I have with my providers. And I say that because they all have to work cohesively together. So what would I say to someone who hasn't yet found the right provider? First, I would ask that individual to go inward. And I say that because typically we're looking for an external solution. We're looking for, okay, maybe I'm not aware of the resources. I'm not aware of where I can find a doctor that looks like me. Those are things that are external or outward. But I would ask the individual to go inward first and consider, why haven't they found a provider? Or what's keeping them from finding one? Is it procrastination? Is it fear? Is it the last time that they trusted someone, they were let down? And I say that because sometimes those are factors that are buried beneath the individual that prevent them sometimes for putting themselves in a position or being vulnerable to have someone responsible for their care. And so I would first ask the individual, go inward. Take a look at the things that, there may be some potential trust factors there. Now, set your expectations. What type of provider would you like to have? What are some non-negotiables for you? And during your first initial visit, which is funny because I did this with one of my providers, go in there with your expectations, explaining this is what I like. I like text message reminders. Have your expectations. And if there's some things that they can't meet, then that's fine. That's not your provider. Try to find another one. And then next, I would say, since you've gotten in the habit of showing up with the list, every visit, show up with a list. Show up with the things that's concerning you, because sometimes those things come up during the week or a month away from the visit that you may not think of. And so come there with your list. And then that way, the list not only holds you accountable to speaking up for yourself and being the voice for yourself on managing your health, but it also holds the provider accountable. And if they can't give you the answer then, or give you the information then, there's a way for you to follow up and you both have something. So those would be some things that I would just say initially. Go inward, set your expectations, and then come with a list.